Professor Vandenplas, thank you for accepting this short interview. I was going to talk to you about KidZ, and I would like to start by referring to the 22 paper you published with a number of colleagues of yours, where you updated and presented this tool. Can you tell us a little bit about the tool, the KidZ tool? What is it exactly?
The KidZ tool is a tool that summarizes the most important symptoms indicating the possibility of cow's milk allergy. So it considered gastrointestinal symptoms, reflux regurgitation, stool aspects, the consistency of the stools, crying, so general behavior, skin manifestations, atopic dermatitis, urticaria, angioedema, and also respiratory symptoms. And what the tool has been developed over 10 years ago, but experience over the years learned us that we needed an update. So the score goes from 0 to 33, and in the beginning we said, well, a score of 12 or above makes the likelihood of cow's milk allergy probable. While by accumulating evidence, we saw that score was in fact a little bit too high. So the 2022 update, what is new in that is that we decreased the score down to 10 or above for awareness for cow's milk allergy. And at the same time, we put also an under limit, because we saw that if your score is 6 or less, then cow's milk allergy is very unlikely to be the cause of the symptoms.
Who do you think benefits the most? For example, primary care physicians, pediatricians, specialists? Who do you think is a target for a tool like this?
I think that primary healthcare professionals probably benefit the most of it, because specialists, of course, they are specialized in the conditions, so they more easily think about it. But if we consider data available from the Europreval study, which was a study performed years ago in Europe for the prevalence of cow's milk allergy, in several countries like Greece and Germany, 5 countries in Europe, primary healthcare physicians did diagnose 0% of non-IgE mediated allergy, which shows they do not know it. So somehow the goal of the tool is to raise the awareness of the healthcare professional of a combination of symptoms that might be indicating cow's milk allergy.
Now, I've seen the abstract you're presenting now in ESPGHAN 2025, and you are using the tool in healthy children. What is the idea of working with healthy kids?
Well, the KidZ is an awareness tool for cow's milk allergy. But so it's parents who get anxious, who are worried about symptoms. And one of the possible negative effects of the tool is that by increasing awareness, you increase the risk for overdiagnosis.
You heard that?
So we thought if we now investigate and try to have information about the level of the score in healthy infants, because every infant cries, every infant has stools, most of the infants do regurgitate. So how frequent do they regurgitate? How many hours a day does a healthy baby cry? And that provides information about normality, and that will help the parents to be reassured that in fact they should not be worried at all. And if they still consult a healthcare professional, the healthcare professional might then use that information to show to the parents, look, what you're saying is completely within normality. So please do not worry. You do not need medication. Your child does not need special formula. It's all within normal ranges.
And since you mentioned the parents, one last question. You are presenting now a Pre-CoMiSS. This is another different tool with another different target. Can you tell us a little bit about that?
Yes, well, the idea was parents nowadays go anyway on the internet. And the internet is full of unvalidated information. So on the one side, the idea was, let's give parents a validated tool which they can fill in and prospectively record, write down the severity of symptoms and go with that information to the healthcare professional. Because we know also that if during a consultation the doctor asks the parents, how many hours does your baby cry? The parent will overestimate that.
Yeah.
So if you collect that information prospectively, the score will probably be lower because parents will then correct the real information, which will again decrease the score finally and help to reassure and decrease the risk for overdiagnosis.
And give us more precise diagnosis.
Yes.
And refer the kids that really need to be referred to or maybe a third level of attention or something like that.
That's the idea of the Pre-CoMiSS, is collect reliable information for the healthcare profession.
Right. Well, thank you. Thank you very much for your time.